What do you do when you do not have a primary care physician and you need to seek care? You may consider going to your local emergency room, but what is an emergency? Today, we will talk to one of the chairs of our emergency departments at Trinity Health Mid Atlantic to discuss when to seek care at an emergency room or your local urgent care facility. I'm your host, Margie Zimmerman, and this is Beyond the Stethoscope. Thank you for joining us today, Dr. Bendesky. Can you please tell us about your background and a little bit about yourself?
Sure. I grew up in South Jersey, in the Philadelphia area, and went to college in Philadelphia. Trained in emergency medicine in Philadelphia. I'm a board certified emergency medicine specialist here at Mercy Fitzgerald. I've been associated with Mercy for off and on for about 25 years. I've worked in the university, a couple university settings over those years, but came back here to Mercy. I'm now the chair of the emergency department here at Mercy Fitzgerald. And I split my duties between clinical duties in the ER, which I'll be going to right after this interview, and administrative duties.
So, this is like your second home.
This is my second home. My wife might say it's my.
Well, we're happy to have you here. So, today's episode is all about when to visit the emergency room. It's been a hot topic in the media when you should go to the emergency room, when you shouldn't. So, I was wondering if you could talk to that. When should people visit an emergency room?
Sure. The emergency department is there and designed to be there to really help for any acute medical issue that exists. That being said, there are certain symptoms and ailments that, of course, you should not delay at all coming to the emergency department there. Things like chest pain or weakness or stroke symptoms. Those are things that we are obviously there. Acute trauma, injuries that are severe. That's what we're there for. But we also recognize that we're an available resource for everybody. We're there 24/7, 365. And we will handle any complaint that comes in. And part of the challenge of doing that is just to sort out which patients need attention immediately and which patients need attention a little bit later. But again, we are a part of a larger medical system that, again, the design is to be there at all times for whatever anyone needs, but recognize that we are trained to try to sort out the most emergent symptoms and conditions first.
It seems that ERs, not only in Trinity Health Mid Atlantic, but across the country, are experiencing non-urgent matters on a daily basis. And then I think the people that are actually waiting to have an emergency get very upset about it. So I didn't know if there's, you know, things that you would tell, patients that when they're experiencing pain or something, when they should really go to emergency room.
Yeah, I think that any condition that happens acutely or suddenly, we obviously put a lot of attention to that. We have nurses that will triage you. We may have providers that come out to triage to see you if we're busy and we don't have room immediately. But we see a entire spectrum of symptoms that come in. And there are conditions where the symptoms seem minor, but are potentially more serious. And again, through the process of triage, where we take your vital signs, talk to you, look at your medical history, we hope to really put you in the right spot in the queue to be able to see you. I would tell most people that if you have a complaint that you've had numerous times before and you've seen multiple doctors for it and it's aggravating you again or bothering you again, that may not be the time to go to the emergency department. I would tell you, if you are a young, healthy patient who is sick with an illness that your other family members have, and you're not debilitated, that you may not need the emergency department. We have urgent cares and primary cares for that. And that being said, I tell everyone, if you're that concerned, we're there to help you. But you will be assessed and evaluated by our team and put in a place in line that seems appropriate for you.
That was going to be my next question. So, with the wait times, how do you prioritize who is seen first?
So, some of what happens behind the curtain for patients coming to the waiting room is you may not see the ambulances arriving in the back. Um, Whenever someone presents to the emergency department, whether it's by ambulance or through the waiting room, we do a triage. And what that involves is usually one of the nurses will first greet the patient. We'll talk to EMS, find out the vital signs, the complaints. You'll go into the triage room from the waiting room. You'll talk to the nurse, get the vital signs, get the complaint. And then there is a system called the ESI system that the nurses use to put you in a category from 1 to 5 based on the severity of your complaints and your presentation. And the nurses will then, in certain conditions, come get one of the providers, one of the APPs, the advanced practice, the professionals, the nurse practitioners, the physician assistants, or one of the attending physicians to come evaluate their patient to kind of help, again, put them in line. And we make that decision using all the information we have at the time. And sometimes that means you get plucked out of the waiting room and come right back. There's also times when you come in on a stretcher with the ambulance and you get put into the waiting room because we have patients that are prioritized before you based on their severity.
Thank you. And can you tell me what is the most common reason you see people in the ER?
The general answer is pain. So humans don't like to have pain, so anything painful. That being said, we do see a lot of abdominal pain ailments that, again, they range from very simple stomach viruses or indigestion to surgical emergencies where we have to rush you to the OR quickly to fix something. So we do see a lot of abdominal pain, of course, chest pain. We see a lot of patients with various neurologic complaints that we're sorting through to find out whether this represents a stroke or something more serious. And of course, injury. If someone injures themselves, and that becomes an area that people should use their common sense. If they twist their ankle and they're able to walk on their ankle and they don't think it's broken, we're happy to see them in the emergency department, but that may be more appropriate for another setting. But we do see a lot of minor injuries.
Which leads me to when should patients seek urgent care rather than go to the ER?
It's a great question. And then part of my career, I was actually a medical director for an urgent care. And I worked part of my time in urgent care, worked part of my time in the emergency department. And it gave me a great perspective. And I think that, like we spoke about, if you have a chronic condition that is now exacerbated or bothering you, but you still feel you need some professional advice on how to manage, if it is musculoskeletal, that's certainly reasonable for urgent care. Minor injuries, sprains and strains, and even minor fractures. You fall on your wrists and think your wrist could be broken, sprain your ankle, think it could be broken. Most urgent cares can handle that just well. Minor wounds, urgent care can handle that. Large lacerations with head injury, especially in older patients or anyone on blood thinners, that has to be an emergency department visit. I think that the spectrum of viral illnesses and URIs and do I have COVID and do I have flu and I think, or do I have a urinary tract infection? Things that would not require advanced imaging like CAT scans or MRIs would be appropriate. Most urgent cares have regular x-ray. Most urgent cares have point-of-care labs. You can run a chemistry on someone, check out their kidney function. But many of the urgent cares are staffed by nurse practitioners or physician assistants. Some of them have attending physicians that are trained. Sometimes it's emergency medicine, sometimes it's family medicine. And that's one of the things about urgent care is that the the ability of the urgent cares varies very much depending on um, who it is. And a lot of the urgent cares that are run by university hospitals are run a little bit different than the retail urgent cares. So what I would say to someone is to familiarize yourself with the urgent cares that exist in your area. Find out what their capability is. Speak to your family doctor about when to call your family doctor, when to go to the urgent care, and when to go to the ER, based on the medical history that you have.
Great. Well, thank you so much for answering all these questions. I know you guys have a lot to deal with in the ER. Um, and I was wondering if I could hit you with some rapid fire questions, and then if it's okay with you, and then you can just answer them. Tell me what comes to your mind first when I asked you the question. Is that okay with you?
Perfect.
Great. People have a much better chance of not ending up in the ER if.
If you have a primary doctor, you keep your appointments with your primary doctor, you take your medications as prescribed by your primary doctor. I think a general theme is that we see a lot of patients who have really fallen off their treatment track, and they have a complication. And so I do think if patients trust the medical system as a whole and do their regular follow-ups and follow your doctor's advice, you are much more likely not to end up seeing me in the ER.
Good advice. Knowing what you cringe a little when you see somebody do what?
Call an ambulance when you are young and healthy and you're not that sick. And yeah, that makes us all cringe. We also cringe when you come to the emergency department for severe abdominal pain and have to put your fast food away before you come to the back. So those things make us cringe a little bit. Yeah.
Be sure
True.
not to do any of those.
Yeah.
What do you know about emergency medical situations that the common person should know?
The common person should know that, again, the more medical problems that you have, the older you are, the more sudden something comes on, take that seriously. Again, we're happy to triage you and see you there and at the emergency department and say, no, I think this is okay. You may have to wait a little bit, but I think taking complaints of chest pain, sudden abdominal pain, neurologic symptoms seriously coming in, very important. I would also think that patients and families need to understand that um, all the hospitals don't necessarily talk to one another. We don't have all of your medical history, all of your medications at our fingertips immediately. So bringing your medical history, bringing your family members' medical history and medications is so important. It allows us to try to sort through the severity of what's going on and to learn about you as a person. I meet a lot of people for the first time in the emergency department in a really bad situation, and having that information is really important.
Right, great. What is one medical skill everyone should learn?
CPR. Everyone, the American Heart Association, there are numerous classes around the area. You just have to really look online. And in this day and age, everyone should be able to provide CPR and then call 911 to help someone that they see in distress.
I agree. Well, thank you for joining us today, Dr. Bendesky. This has been very informative and very helpful. I know a lot of people go into the ER and they don't understand the wait times and what goes on behind the scenes. So we really appreciate you sharing all of your information with us and your expertise.
My pleasure. My pleasure. Thank you very much.
Thank you. Thank you all for joining us today. Please stay tuned for future episodes of Beyond the Stethoscope.